You've heard of intrauterine insemination, and you obviously are aware of the common type of infertility treatment, which is IVF. You are trying to have a baby and you are so confused as to which one is best for you. This video has come to help you solve that problem, to educate you, to help you work out what the difference is between intrauterine insemination, also known as IUI, and IVF. Be confused no longer and keep watching. Hi, this is Hey Doc with me, Dr. Kady. On this channel, women's health, pregnancy related matters and fertility medicine are our thing. If you like that kind of thing, make sure you subscribe, like, share, and help us get our message out there. Right, let's start with IUI. It is a less invasive procedure, as well as being simpler. The sperm is washed with a specialized chemical, and this treated sperm is then inserted directly into the uterus. But the insertion of this washed sperm doesn't just happen at any time. Basically, you don't just get sperm inserted into your uterus whenever. No, the time at which the sperm is inserted into your uterus is specific, and that time is around your ovulation time. And the reason for doing that is to increase the likelihood of fertilization happening. In vitro fertilization, on the other hand, is a lot more complex. After stimulating the ovaries over a period of a couple of days, the follicles within your ovaries get bigger. This makes egg retrieval from those follicles within your ovaries much easier. So once your eggs have been retrieved from those mature follicles, these eggs can then be placed into a specialized petri dish within the lab. Now, at this stage, there are two ways in which fertilization can be allowed to happen. The first one is known as intracytoplasmic sperm injection. What happens here is that there will be a sperm cell within a specialized kind of needle. The sperm cell that is then found within this specialized needle is then injected into the egg that is within the petri dish. That is one of the ways in which fertilization can happen with IVF. The more common way for fertilization to happen in IVF is for the sperm cells to be placed within the same petri dish where the retrieved egg will also be. With this last method, fertilization is allowed to happen more naturally. So a sperm cell, one of the sperm cells will obviously swim and be able to enter into the egg found within the petri dish. The now fertilized egg will start to divide and there will be multiplications of the cells. It will be kept within the lab for a period of roughly 2, 3, possibly even 4 days. Once the egg has reached a certain level of multiplication and is obviously it will be kept under, very strict conditions, will allow the fertilized egg to multiply as it would if it was inside of the uterus. Once it reached the satisfied level of multiplication, this fertilized egg, which is now considered to be an embryo, will then be removed from this special storing condition, then inserted into the woman's uterus, where we hope and pray and very optimistic that it will be able to implant itself into the endometrium of the intended mother. That's the procedure with IVF. The last technique is a more natural way to allow fertilization to happen. Now that we know of the technicalities of the two different procedures, let's now directly compare the two procedures. The first area of comparison will be procedure complexity. Intrauterine insemination is much less invasive. It's simpler in terms of the fact that it doesn't require egg retrieval. It doesn't require follicular stimulation in order to be able to retrieve the eggs. Yes, there will be at some point some type of medical equipment that is inserted into the woman's uterus, but that's just that once. There aren't multiple drugs drug injections, there aren't multiple in and out of the woman's uterus, if you get what I mean. Unlike in vitro fertilization. With in vitro fertilization, it is very complex. So the woman often has to be mentally ready for the different steps that are involved with IVF. So the first step is stimulation of the follicles within the ovary, and that will include injecting oneself with multiple different drugs. And then once the follicles are big enough, injecting yourself with a drug that will trigger the eggs to be released from the follicles. So if you're someone that's squeamish and you don't really like needles, you have to bear in mind that the complexity of IVF will require you to have multiple injections over a period of a couple of days. And towards the end, and when you're getting closer to egg retrieval, you will be injecting yourself twice in a day. After that has happened, obviously there's the fertilization that has to happen in the Petri dish, and then once that has happened, there is a specific time at which you and your gynecologist will have to meet in order for the eggs to be retrieved. Either via through your abdomen if you want to do it laparoscopically, or through an ultrasound if you do not want the device inserted into your vagina. But if you don't mind vaginal retrieval of the egg, a probe will be inserted into the vagina and then the eggs will be retrieved that way. That's egg retrieval. After fertilization then happens in the Petri dish, and then we are at embryo level. That embryo will then have to be inserted into your uterus, again through the use of a medical equipment. So you see, there are lots of ins and outs of your vaginal orifice, and timing is of the essence with IVF. The second area of comparison is success rate. Though it's less invasive, IUI has got a lower success rate, unfortunately. The success rate is around 10 to 20%, depending on other factors, of course, like age and other fertility issues, like, for example, if the woman has endometriosis or various other factors like fibroids. Those will also further reduce the success rate of IUI. Guess what? In vitro fertilization has a much higher success rate, where we estimate the success rate of IVF, all being well, to be between 40 to 50% per cycle for women under the age of 35. The success rate of IUI is probably the reason why it is less common. The third area of comparison is the cost. IUI is obviously going to be cheaper, more affordable. Now, that's mainly because you don't have the expensive drugs to buy. Those drugs are really expensive. And so if you're going to have to stimulate your eggs over a period of 10 days, 14 days, that's a lot of money that you're spending on drugs. And so with intrauterine insemination, if all of that is removed, so with intrauterine insemination, if you don't have to buy the drugs and you are going to the doctor's office who's going to have basically an area of preparation where the sperm cells are going to be washed, and in their go, you're cutting a large chunk of medical expense. With in vitro fertilization, so with IVF, you're stimulating your eggs. Once you're stimulating your eggs, you're then going to retrieve your eggs. So you have to pay for being in the theater. And you have to pay the cost of the doctor who's going to retrieve your eggs. Then you have to pay the cost of the lab where, the meeting of the egg and the sperm is going to happen in a Petri dish. You also have to pay the lab over the couple of days that the embryo is going to be multiplying in the Petri dish within that lab. Then you have to come back. You have to pay the doctor again who's going to insert the developed embryo that was in the lab into the uterus, as well as the lab technicians who are going to bring your stored embryos. You see, IVF is not a joke. If you are considering it, make sure that you can afford it from beginning right through to the end. In fact, I think your doctor will be doing you a great disfavor if he or she do not discuss all the cost involved in intricate details before you decided to go for it. I can't think of any doctor that would do that. I genuinely can't. Let's talk numbers. IUI can cost you anything from $500 to $4,000 US. IVF, on the other hand, you could be spending 12 to 20,000 US. I told you, you've got to be prepared financially if you are going to go for IVF. Not to talk of some couples who go for 1, 2, 3, 4, multiple IVF rounds. You have that child, you think, what's the big deal? It's so easy to have children. That's not the case for everyone. So be grateful for what you have, because what came easy for you, that's not the case for everyone. Number 4 is time and commitment. I mentioned time already very briefly when I was talking about the complexity of the procedure. But let me break down to you right now what level of commitment in terms of time you need. IUI requires less time, fewer appointments. In fact, your doctor can possibly do it in his office, the side room down there. If he has all the equipment that he needs, you're done and dusted within 1, at most 2 appointments. That's it. And if you are blessed, it worked, fertilization happens and implantation happens, there you go, you're pregnant. IVF, on the other hand, I told you, it requires a lot of time. You have to inject yourself. You then have to go for ultrasounds. Then you have to speak to the doctor to decide whether you're on the right dose of the medication. Then you have to go for more ultrasounds. Then you have to go and get the eggs retrieved. Then you have to go, look, I've already told you the steps. It takes a lot of time. The procedure from injecting yourself to egg retrieval alone can take up to 2 weeks. Then you have the extra 4, possibly even 5 days that you have to add for the egg to meet with the sperm and the multiplication to happen within the Petri dish. Then you have the time when you're going to be called back and you're going to have the embryo inserted. All in all, IVF can take anything between 4 to 6 weeks. Who is it for? IUI, we think of it as the appropriate procedure to go for couples with unexplained infertility issues when we suspect that the cause of infertility is mainly the man, but that the infertility factor or the factor that's causing the man to have a low sperm count is rather mild. It can also be used when there are mild ovulation issues, when the ovulation is not consistent, when the woman is ovulating, but it's a little bit difficult to work out exactly when it is that she's ovulating and when it's not consistently the same every month. IUI is appropriate for this cohort of patients. IVF, though, is used in severe infertility issues. For example, when we are dealing with blocked fallopian tubes, advanced maternal age, severe endometriosis, or significant fibroids. Those causes of infertility, don't mess around with IUI, go straight for IVF. Now, let's summarize by considering the pros and the cons of each procedure. IUI. Let's start with IUI. The pros for IUI include the fact that it's less invasive, it's more affordable, and the fact that there are fewer side effects. The cons are it has a low success rate, and it is predominantly suitable for those with milder infertility issues. If you have been diagnosed with severe infertility, you have 1 or more causes of infertility. Worse, if you and your partner have been told that both of you have a cause of infertility, so it's not just the woman who has a cause of infertility or the man that has a cause of infertility, it is both of you who have a cause of infertility, stay well clear of IUI. Yes, it's cheaper and less expensive, but who wants to be wasting $500 or even $4,000 when you could be using that money towards a procedure that is actually going to have a higher success rate and with which you have a higher chance of actually conceiving? The pros of IVF. The first has to be that it has a higher success rate. and closely followed by the fact that it can be used for more severe and more complex fertility problems. The cons of IVF has to be the fact that it's invasive, it's expensive, and very time consuming. I conclude by saying both IUI and IVF have their place in fertility treatment. However, what you must consider is that the best option will depend on your unique condition. So always consult with your fertility specialist and be guided by the tailored advice that he or she will have for you. If you have found this video helpful, remember to give it a thumbs up, share it with someone who might need it. And as you know, we always appreciate your support right here on Hey Doc, and we'll appreciate a subscribe. And as you subscribe, you will receive notifications for more helpful tips right here on Hey Doc. Take care, and we will see you in our next video.